Are we going to help Gazans survivors and look at them as people who survived a disaster? Are we going to look at them as people who survived an earthquake that continued for seconds, destroyed a few houses, but now they are safe? Are we going to look at them like people who were exposed to a tsunami, their houses got drowned, but they survived, they lost some of their people, but now they can rebuild back? Or we are going to face the reality that not a single family have not lost a member of its people. And we need to plan in accordance with that as professionals, as health professionals, as mental health professionals, how we are going to help people recover and heal after a genocide. It's not a simple disaster. It's not a simple war. It's a lot more than that. Well, first of all, okay, we can say that everyone talks about trauma-informed care. When it happens, there is an area of disaster, then when you are trying to respond, you start with some specific interventions. For example, you provide psychological first aid, you provide some stress reduction interventions, but the overall name could be, or title could be like trauma-informed care, like you focus on healing the trauma of the people, helping people overcome their traumatic experiences, reprocess the traumatic event, reconstruct the traumatic event, and then help them go on with their lives. But there are 3 conditions for that to happen. First, all the attacks, all the offensives should stop. These attacks should stop. Second, people should not feel that they continue to be under a threat. I mean, ceasefire means a ceasefire, no more threat. Third, people will need to have clean, good environment, which means you need to remove the rubble that is present everywhere in Gaza Strip. You need to clean the neighborhoods. Okay, and then you allow the recovery processes to start. Some of those recovery processes are natural because we are driven to go on with our lives, But a lot of us, especially after a genocide and again, for example, some of the studies say that 50% of people who develop PTSD, post-traumatic stress disorder, who become diseased, with a disease, exposed to trauma and then develop the disorder, 50% of them will recover spontaneously after 6 months or within 6 months of the diagnosis, But the other 50% will need specific intervention. If we apply that to Gaza Strip, then how many among the 2 million people were exposed to trauma? All of them. How many developed the disorder? The minimal figure that you can talk, according to some WHO studies, is that 10% of the population will develop moderate to severe mental health conditions, including PTSD, even schizophrenia, severe depression, etc., etc. That's 200,000 people. For those 200,000 people, including children and adolescents, men and women and everyone, they will need the ability to go on with their life. So in addition to that, you need going on with your life, allowing recovery, which needs going back to the normal functioning. For a child, the normal functioning is 2 things. First, to play, because this is a very simple right of children. Second, schooling. And these are the very little things that you need to, basic things that you need to provide. Now, unfortunately, and again, why we speak or say genocide, we need to add to those 2 simple basic conditions, food. We started having these offensives since 2008-9. Many of them happened, and we all the time talk about the need for feeling of safety, the need to have security, the need to have protection, and the need to return to normal routine life. On top of things for children is play and schooling. We never spoke about food. Today we speak about food. Obviously, clearly, loudly, because we see children losing weight, we see children dying from starvation. And then when you have these 3 components, you have the environment that would allow mental health professionals to help the healing processes. Now what we are trying to do is try to prevent the damage that is happening and occurring every day. We try to support, we try to help the people who are devastated one way or the other go on with their lives. But for a nation to recover and to continue living, we need that. And then we need insurance that things will continue to be, that people will continue to be protected, that these things are not happening again and again. And what we are talking about are very simple things that are known for in every place, things that are written in all international humanity or whatever records, declarations, interventions, whatever, these are very basic things that we are requesting for the Palestinian people in Gaza Strip to have. And then there are some people who would come up with very strange questions. Let's wait and see the second day what will happen. What does that make a difference for 50,000 pregnant women in Gaza Strip? What the second day means to their embryos, to their children? What is that going to mean for those who are another 50,000 children below the age of 1 year? I mean, there are clearly responsibilities of the international community towards what's happening now in Gaza. And history is going to write down and register how everyone dealt with what's going on.